Good morning, good afternoon, depending on where you're watching this video from. My name is Dr. Eunice Menja. I am so thrilled to bring this topic to you in cultural diversity in mental health practice. I do have over 13 years of experience teaching developmental psychology, human sciences courses, and many others at the university level in Kenya and even in the US. I am bringing a wealth of knowledge to you, um, and of course to our discussion today. My professional background includes extensive experience working with substance abuse patients in rehabilitation settings. I am an LMFT, which means I am licensed as a marriage family therapist candidate. I have to specify that I am working under supervision in the state of Oklahoma. I work with families and individuals. I do have the privilege of serving in various roles within the Department of Human Services, still in Oklahoma. And I've worked as a family services specialist, and I've also worked as a child welfare specialist in foster care. So, throughout my career, I have developed and delivered training programs on childhood trauma and have provided direct support to children that have been in the streets and all abused because I established children's homes back in Kenya. Additionally, I facilitate substance abuse rehabilitation programs for youth and even for adults. And I also work as an independent certified life coach, helping individuals, families, and couples achieve their personal and relational goals. I'm also a three-time author, which reflects my commitment to contributing to the field of mental health and community well-being. One of my books is talking about when your child hurts, and it is actually a resource for parents to help their children talk about emotions and depression and stress as a way of trying to prevent a suicide. I look forward to sharing this information and the experience that I've gained so that I can make a significant impact in the field of mental health and especially considering the cultural diversity. So be with me today as I go through these slides, and I hope that you enjoy my video. Thank you for being here. If you're my student, make sure you like my video and take your notes. Share it with your friends. If you're just here to learn, welcome and thank you for visiting my channel. So let's talk about cultural diversity and the central role that it plays in mental health practice. So, as mental health professionals, we do encounter clients from various cultural backgrounds. Um, comes with their unique beliefs, values, expectations, and they expect us to help them regardless of our cultural background. Our ability to understand and adapt to those cultural differences, it's going to directly impact the success in our profession. When it comes to giving diagnosis, when it comes to doing the assessment, the treatment plan, and actually even helping a client go through the emotions and whatever they're dealing with, and that is the overall client satisfaction. By the end of the day, we want to make sure that we meet their needs and we meet their mental health needs, regardless of what our beliefs are and what our values are. So I want to give an example. As a therapist here in the US, I work with clients from a collectivist culture, like maybe Japanese. This type of client may need to focus more on family dynamics and community well-being rather than individuals' personal growth compared to, the obviously the individualistic culture of America. So because America is, I want to say, is a melting pot. We have a lot of diversity, cultural diversity from international students and even families that have migrated to this country. So today I want to just dig into our cultural differences and how they can manifest in the mental health world or profession or health setting. So if you're taking this course because you are an occupational therapy student or mental health student, or you are going to just be in the general medical field, that is okay, because this course really applies to you. So as clinicians, what we can do is to make sure that we ensure, culturally sensitive care. We don't want to serve our clients, based on what we know. We want to serve our clients based on where they're coming from. So the practitioners must adapt the approach to meet the unique needs of diverse clients, and we have to have that cultural competence that helps us or enable us to provide culturally sensitive care. Um, you know, Cultural competence enhances the effectiveness of any work that we're going to do. So, I'm going to explore specific ways culture can influence mental health practice today in the next slide. So, stay with me. So, one of the most important aspects of mental health practice is recognizing how symptoms are expressed across different cultures. So, I want to give an example. In some cultures, emotional distress might be communicated through physical symptoms. So, a client from a place like Eastern Asia might report stomach pain or headaches instead of saying the feelings of sadness or anxiety, because this differs from Western cultures where mental health conditions like depression or anxiety are more often discussed in terms of emotional and psychological symptoms. And that's how you're going to hear, because of the way people are educated to label mental health issues. So what is labeled as depression in one culture may appear as just physical pain. Somebody says I'm having stomach pains, or I have, I feel like I have diarrhea. That means maybe they have a lot of stress. Um, so failing to recognize these cultural variations can lead to misdiagnosis or misunderstandings. So, a clinician who isn't familiar with these different patterns, which we are trained when we are taking our mental health, education, we read research, and that's how we are able to know about these, different cultural patterns. So, if you're not familiar as a clinician, if you don't familiarize yourself with, different cultures and what the research says, especially in the mental health field, you may label physical complaints as, somatic, without understanding their deeper psychological roots. So it is very important that you recognize the culturally specific symptom expression, which is key to accurate treatment. And of course, how do you do that? By asking your clients. When somebody comes into the office and say, I feel depressed, it is very important not to assume that it is the DSM-5 depression that you know about. You need to explore further, asking questions, and what does that look like? Because you cannot assume that Dr. Mr. Joe depression is the same as Dr. Eunice's depression, because I'm a Kenyan, I'm African. So what I say depression is might be different from somebody who is from Mexico. So just make sure that you know that you're aware, because cultural barriers can also prevent clients from seeking help. And I know that African culture, we know that we are trying to really break the stigma, but the stigma is still there. Cultural barriers often influence whether or not individuals are going to seek mental health support. So in many cultures, mental illness is going to be regarded as a personal weakness or failure, which is going to discourage people from seeking help. For instance, in some African and Asian communities, mental health conditions may be explained as, spiritual causes or curses, leading people to consult religious or traditional healers instead of therapists. People will say, yeah, you have demons, so you need to be delivered, or you need to go to see your priest or your pastor so that you can be prayed for and be forgiven because you are possessed or demon possessed. So some cultures associate mental illness with shame or spiritual failure. Maybe you haven't prayed enough, maybe you have offended God. That's why you are being attacked by demons. A real life example comes from a study with Latino immigrants in the US who often felt shame around depression and anxiety. It led them to delay seeking mental health care until symptoms became very, very severe. When somebody has a mental breakdown, and that's when we try to, think about what else could be going on. This can lead to delayed treatment or reliance on non-medical intervention. So somebody might actually have a very severe mental breakdown, including committing suicide. And that's when you actually realize that somebody was suffering from depression and it was never treated. Understanding these cultural barriers is very, very crucial for clinicians and therapists, as it is going to allow us to approach clients with sensitivity and awareness that it requires or it deserves to help create a supportive and trusting therapeutic environment. Therapists need to really understand these barriers by, reading research, consulting people from the same culture. If you have a client who is coming to see you and this client, you really don't understand about their culture, and maybe you have somebody in your team or in your practice that is aware or is from that culture, it is very, very important that you ask so that those barriers do not prevent you from, helping your client effectively or engaging with your client effectively. Okay. So the other thing that I'm going to talk about today is how cultural norms around mental health vary widely and really can influence how people perceive mental illness and treatment. In some cultures, admitting a mental illness carries a significant social stigma. And another example, in South Asia communities, people with mental health conditions may be ostracized or considered crazy, which discourages them from openly discussing their struggles, in contrast with Western cultures like America. Clients may feel shame or fear judgment, making them reluctant to seek help. And I know that is very, very common in my African African culture. So in Western cultures, on the other hand, may be open to discussing mental health, even in the classroom, but can still have stigmas around surrounding certain conditions like things like disorders like schizophrenia or personality disorders. Uh, Um, Another example is seen especially with the military veterans, when the culture of toughness often prevents individuals from seeking mental health care for conditions like PTSD. You're a military, you're a veteran. Why are you looking weak? Why are you not, moving on with your life? And that can also be, can also really prevent people from seeking help, especially when they come from places of war and they might have PTSD, which is post traumatic stress disorder. So recognizing these cultural stigmas within gender and outside gender, help us tailor interventions and also to be able to reduce judgment in therapy settings. So therapists must be able to create a supportive environment that acknowledges cultural stigma. So, I have seen this even in even in my own therapy room. You will find that more women are coming for therapy than men. And that is also another way of looking at it as a cultural barrier and also as a stigma. Men are supposed to be tough. They should not be seeking mental health because that's a sign of weakness. And really is. We know that it is not a sign of weakness. Everybody can and anybody can be suffering from a mental health issue. Okay. So culturally tailored treatment. Culturally sensitive treatments mean you tailor therapeutic approaches to cultural context of the client. So when you're building reports, when you're doing the assessment, there are so many questions that we ask. Sometimes we ask the clients if they want their treatment to be tailored to their faith, to be tailored to their cultural traditions or their beliefs or values, and that is very, very important information to have. So one approach doesn't fit all. So you cannot have a treatment plan because you have five clients that are suffering from depression and treat them all the same. So you must be able to tailor that treatment. So because treatment plans must reflect the client's cultural background and their values. So if I've heard I had a client who told me that they stopped seeking help because their client was um, over spiritualizing everything. So, and that really, as a Christian, made me think again because I might not, I don't want to do that to my clients just because I am a Christian and I have my faith that I can use. I always ask for permission. If my client wants prayer, if my clients don't want prayer, if they want me to quote the Bible, I have to make sure that I ask for that permission. And that is, I am considering their cultural backgrounds and their values and their beliefs. Okay. And so, for example, in collectivist cultures, family and community often play a very critical role in decision making, and clients may prioritize their family's well being over their mental health. And that is another point that I have said before, family involvement being important. So if you're bringing, if an individual is having, a problem, they might not seek help because they want to make sure that the whole family is on board about it, or they might just consider themselves not sick because if the rest of the family is not sick, then even them they're not sick. So they don't prioritize about own um, seeking their own therapy. And if they do, they might want to bring the whole entire family, that's why you also need to tailor that treatment towards that entire family, even if it's just one person that is sick. And that's why I love about marriage and family therapy, because we are really taught to use the systematic way of giving therapy. So everybody that comes, you look at that person as a system that includes the whole entire family, because the system operates not as a single. So we usually say that the whole is bigger than the sum of the parts. So the whole entire family is more important to consider when you're providing therapy. Culturally tailored approaches improve client engagement and treatment outcomes. And I am telling you that for sure, that people that feel that you have tailored their treatment to just them, and it is not just like a collective treatment plan that you give everyone. You tailor that personal therapy to align with their cultural values and their beliefs. They are going to really, really be engaged, and they'll be you're more likely to get success or out of that treatment, because failure to consider cultural values can lead to ineffective or rejected interventions. Why are you treating me this way? And these are my beliefs. Why are you just providing me with scientific information, while I want to, I believe that God can heal me, or Allah can heal me. So whatever it is that they need you to tailor their treatment to based on their beliefs and their values and their cultural background. You have to do that. Okay. So it is an obligation as a therapist or as a clinician to tailor therapy to align with your client's cultural values. You can't do it any other way. Right. So let's talk about a little bit about therapeutic techniques themselves, which may be, and if you haven't watched some of my therapeutic techniques that I have been doing, I have done a few of them. I have done cognitive behavioral therapy. I have done strategic family therapy, which is, that one is more for family. CBT, you can use it for family and you can also use it for individual counseling or therapy. So therapeutic techniques themselves may need to be adapted to respect cultural differences. So what you read in the book might be completely different to how you're going to apply that technique. As I said, when even though I use strategic family therapy, which is, the family, the parents being, like the authority figure and the children being at the bottom, I want to make sure that I ask the family, is this how you want your family to look like? Is this how you perceive your family as, the parents having more authority over children? And sometimes may just say, no, everybody has the same equal power. So you will have to adjust that therapeutic technique, even though um, so I was saying that because what therapeutic, if one therapeutic technique works well in one culture, it might not be effective in another culture. So you might have to actually tailor those therapeutic techniques towards that particular culture, and not just the culture, but the individual or the family. I want to give an example of mindfulness as a technique, and other practices that may need cultural adaptations. Mindfulness technique has roots in Eastern traditions, which may resonate with some clients, but feel uncomfortable or other cultures. So you might have to be careful because mindfulness is really one of the techniques that is also oriented to religious backgrounds, if that makes sense. So I worked with a client one time, who was a devout Christian and believed in prayer and fasting. Felt very uncomfortable with meditation practices, even though they were Christian. So instead we focus on prayer and spiritual reflection as therapeutic tools. As therapists, it is important to be flexible and open to adapting techniques to fit the client's worldview while still ensuring that the therapy is effective. So you have to assess the cultural fitness and make sure that your technique is essential for the therapeutic success of that particular individual. Being flexible and asking your clients questions as you go. It's very important that you ask your questions whether this works. You might start a technique and then next week they come and tell you, I don't think that is working, or I don't think that I'm seeing results. And then you might ask more questions and see what can you tweak in that intervention, so that you can be more supportive than having your clients not feeling like you're really helping them. Okay. So language is one of the most significant barriers in delivering effective mental health care across cultures. And I'm not just talking about English versus Swahili or English versus Spanish. When you talk about language, and if you haven't watched my cultural diversity introduction video, you need to watch that, because language is not just the words we speak. So when clients speak the same language as their therapist, certain mental health concepts or terminologies might not translate well across cultures. Because, like now, for example, this video might be watched in Kenya, might be watched in Canada, might be watched in America. But there are some words that are, even though they are English, mean different, different things. For example, let me give you an example of the word gas. When I tell you that I'm going to put gas in my car, I'm meaning that I'm putting petrol in my car. If you say the word gas in Kenya, they might not understand what you're talking about because gas is for cooking or any other place. So terminologies, even though you are speaking the same language, the same English, it is going to differ because you are coming from a different culture. So language differences significantly do affect therapeutic process. When you're talking to someone, when you're sitting with them, you might say a word that really offends them. And that wasn't your plan. That is not what you envisioned when you use that word, but they might get very angry. So direct translations may not capture the full cultural meaning of mental health terms because a client may not have the vocabulary to describe their emotional state in ways that align, with, our Western diagnostic framework. And most of the times we use the DSM-5, which was written, um, you know, the DSM-5 was written by the American, psychological associations, which is, that's, definitely what that means is that, an immigrant client from China might not describe their symptoms the way they are described in DSM-5, and you might actually have a lot of differences. Even if you are using DSM-5 in a different country, you might have, you will see these differences uh, as they pop. So somebody from China, may refer, their problem as losing face. This is a concept tied to shame and honor that doesn't have a direct English, or it's not equivalent to what you know. So using interpreters culturally adapted assessment tools and being patient with communication challenges, because they're going to be there, can help bridge this gap and ensure that we are accurately understanding and addressing, our clients' mental health needs. I've heard clients tell me that, they don't want me to be their therapist, and that doesn't offend me because maybe we have a cultural, barrier, or we have a language barrier. Maybe when I say some words they don't understand, and when they say that, I appreciate that they give me that feedback because I'm not preventing them from getting the help that they need. I'll try to speak clearly, and I'll try to ask my clients if they understand me, and if they can't understand me, yeah, I will have to make sure that they see another therapist. Okay, so clear communication is very, very, very important. And how do you know whether you're communicating clearly? Always seeking feedback from your clients. At the end of the day, your clients are the most important. Um, they're the most important people in that room. Your clients, you have to make sure that, and you also might not be understanding what they're saying because they mean something different from what you're used to. So you have to consult with your supervisors and your other colleagues what some of those words mean, making sure that you're not breaking confidentiality, because that's also very, very important. And also paraphrasing so that the clients know that you are understanding, or even asking them to repeat. You can repeat the sentence and just ask them, is this what you mean? Just to make sure that there are no language barriers in that conversation. Okay, so building culturally informed relationships. So the therapeutic relationship is the foundation of effective mental health care, and cultural competence will play a key role in building trust. Clients are more likely to open up and engage in therapy when they feel that you understand and you're respecting their cultural identity. Okay? That is key. Trust and respect are critical in building rapport. Trust and respect are very critical in building that therapeutic relationship across all cultures. Everybody needs to know that they can trust you as their therapist. Therapists should acknowledge their own biases and learn from their client, because people have biases. There are some times I have said I might not be able to take this type of a client because I don't want my biases to get in the in my way of helping them. This is not the example that I'm giving for whom I would not work with, but for obviously, I would never want a certain client to watch my video and think, oh, Eunice has a bias towards me. No, that's not what I'm saying. This is not the example I'm giving, but I want to say I do remember working with a young Muslim woman who was hesitant to discuss certain personal issues because she wasn't sure if I would understand her religious values. And the reason why she did that is because I had a Christian verse on my desk, and that actually was going to get in the way of building that relationship. But by showing interest in and respect for her culture, I was able to build a stronger connection. I was able to break that barrier. um, because understanding the client's cultural worldview strengthens that alliance, that therapeutic alliance. And the client, you cannot fake it. The client will know whether you understand. The client will know whether you are validating their pain or their, whatever their issue is. They will know. So acknowledging our own cultural biases by asking questions and being genuine, you're being genuine and curious when you're asking questions about their worldview. It's going to help to strengthen that relationship, that therapeutic alliance, that is very, very important. Trust and respect is one of the most important aspects for therapy to be successful, and for client, for that intervention to actually produce some good fruits. Trauma experience and process directly across cultures, often depending on historical and social context. So, clients from refugee backgrounds may have experienced severe trauma from war. Clients who are coming from war as veterans, people who have been injured or have lost their loved ones in a war, displacement and loss, compounded by cultural differences. Like now in America, we have a lot of floods. We had a lot of floods in Africa the other day. We have war in Israel. All these are things that really compound the cultural differences and how trauma is understood and treated in different cultural contexts. So in real life, I have worked with people who have come with PTSD. I've worked with, a refugee client from Syria who had survived war but struggled with a lot of guilt over being unable to help his family members who are left behind and perished. I've worked with a war veteran who was always guilty because he was his friend was injured and killed in war in Afghanistan. So in this case, therapy involved involves addressing both the individual trauma and the collective grief and guilt that they bring into therapy. So culturally informed trauma treatment is going to require sensitivity to both individuals' personal experience and even broader cultural and historical context, because a few years from now, there will be that, what you're talking about, the broader cultural and historical context from, just experiencing COVID, experiencing war in Israel, experiencing war in other places like Sudan. So it is very, very important to just be aware that trauma is, COVID trauma, even though it was across the world, it was experienced differently in different parts of the country, in different parts of the world, in different parts of the continent. So therapists must be trauma informed, and they must consider cultural factors when they are treating somebody even with trauma, so that they can be able to address those collective trauma and individual, trauma aspects, when expecting a good outcome. So in summary, or in conclusion, cultural diversity significantly impacts mental health practice. That one, we have no doubt about that. So, understanding and respecting cultural differences is very, very essential for effective mental health care, or just providing, um, effective care. So, from symptom expression and help seeking stigma behaviors to stigma and treatment approaches, every aspect of mental health care is influenced by culture. Culturally competent care builds trust. Your client, the moment you ask your client whether what their view is on on mental health, what their view is in just using their values and beliefs in their treatment, there will be trust. That is going to foster trust, better communication, and it's going to lead to more successful outcome, because recognizing those cultural differences, it's, as we said, as we conclude, it's going to improve how you diagnose them, how you treat them, and how you build rapport, which is the first thing that you do. You have to build a rapport with your clients before you can do anything else. As mental health professionals, it is our responsibility to continuously learn, educate ourselves, and adapt to diverse client needs. We have to constantly educate ourselves, continually educate ourselves on cultural diversity. And we have to adapt our practices to meet the unique needs of every client that we are going to come across. We embrace cultural diversity, whether it is about gender, conflict, gender, transgender, whether it is about, same sex marriage, whether it is about, we have to make sure that we meet every unique needs of every client, whether they are from a religion, whether they are from a culture. We have to make sure that the client's needs come first. Our needs are not important at that moment when you meet the client, because the moment your client comes into your office, ask them why they are there, understand them, build rapport, let them know that you are going to keep the information confidential. Even if they come into your office and say they are struggling with, they have, gender conflict, or they're struggling with, their sexuality, they have whatever issue that there is, you have to make sure that you build rapport, and you show that you care, and you show your empathy, and you just display your cultural competence. And that way, you're going to build trust, you're going to foster better communication, and that is what is going to lead to successful outcome from your treatment. So have fun. Let me hear, obviously, if you have any feedback. These are some of my references. Thank you all for your time and attention today. I do hope that this presentation has given you some valuable insights into critical role cultural diversity plays in mental health field or practice. So as mental health professionals, you need to understand, embrace these differences, so that you can make the world a better place, and the world a better place to talk about mental health freely, and with no fear or favor. Before we wrap up, I would love to hear your thoughts. Please feel free to ask any questions or share any feedback you have, because your insights are definitely valuable to me. And I want to make sure that my future discussions are more engaging. So if you found this presentation helpful, I would appreciate if you could comment, if you could share it, if you could like it, or subscribe to my YouTube channel. It helps to spread the message and create more conversations around important topics like this. Thank you once again. I do look forward to connecting with you. So if you're one of my students, make sure that you do take notes. Thank you for watching.